was a woman who came here with her 30-day-old baby. And that 30-day-old baby had never been in the crib. That 30-day-old baby has spent all 30 of its days in stairwells and at the bus station. And I say to anybody who's listening to that, this is not the city that want to be part of. You know, we have got to have a response for that type of human need. And I'm very concerned about the TANF cuts because I fear is there going to be a whole lot more 30-day-old babies that are going to be facing that kind of life experience. And we just have to be able to do better than that. The second thing is, in terms of TANF, is that the transition from dependence to independence comes with a cost. You know, we just can't cut off a benefit and expect that people without real assistance in terms of finding a job in a very bad economy, you know, if we don't give them a hand to find that job and to get the training and everything else that's needed, it's just punitive. It's just punitive. And in order to have that helping hand, we've got to have a budget for the helping hand. And so it's not, to think that this is all going to be scot-free and just, you know, save $6 million, $7 million, $8 million is faulty thinking. Because those people are going to come back to us at a very high cost in child welfare, adult protection, and substance abuse, and you name it, crime. You know, all of that is what we're providing for when we cut this. So I'm all for cutting TANF benefits if we have the opportunity for people to move on to a new life. They're better off, we're better off, everybody's better off. But unless those programs are in place, I just cannot support these cuts. So here we are. We can now proceed to our public witnesses. We have the DC Primary Care Association has sent a witness for us. Howard Levers, are you here, Mr. Levers? Have a seat. Deborah Shore, Sasha Bruce, Youth Work.
I'm here for Deborah Shore.
Oh, she has a substitute. We always miss her when she doesn't report at our hearings. Well, I think you'll do very well. May I ask your name, please?
My name is Vera Johnson. I'm the managing director of the Community Program and Engagement of Sasha Bruce Youth Work.
A very strong witness, I'm sure.
Worked with Deborah Shore for over 30 years.
Oh my God, is that wonderful? Thank you. We'll give our regards to Ms. Shore, won't you?
I will. She wished to be here, but she couldn't.
Right. Now we have the DC Center for the LGBT Community in Mariner. I don't know if I saw David. If you will pass Mr. Mariner. Freddie Pico, Washington, Metro Washington here. Mr. Pico, are you here? Ms. Pico, I beg your pardon. Thank you, please have a seat. We have the DC Fiscal Policy Institute. Did you want to testify, Ms. Alexander? Where are you? Do you want to testify as part of this panel? All right. Alexander Jageska? Jageska. Now here we go, we have Howard Levers, is that right? Okay. DC Primary Care Association, you have 5 minutes. Ms. Johnson from Sasha Bruce, you have 5 minutes. Ms. Pico from Washington here, you have 5 minutes. And Ms. Jessica, please be kind. Okay. You have 5 minutes. Did you get that? Ms. Hawkins? Good. All right, so let's begin.
Good morning,
Mr.
Chairman Graham and Councilmember Barry and distinguished members of the committee. My name is Howard Levers. I'm the Director of Policy for the DC Primary Care Association. The mission of DCPCA is to facilitate the development and sustainability of an effective, integrated healthcare system in the District of Columbia that guarantees access to primary health care and eliminates disparities in health outcomes. Today, I'd like to focus my testimony on the DC Healthcare Alliance face-to-face recertification, cuts to TANF, and the elimination of interim disability assistance. And I think that many of my comments this morning will resonate with each of the points that you made in your opening remarks. As you know, government has expressed concern with the growing alliance enrollment, even as we move many people over from Medicaid, and are concerned that individuals from surrounding states may be getting enrolled or that other fraud is taking place. Continued enrollment in the alliance now requires face-to-face recertification every 6 months to more closely monitor eligibility. DCPCA understands the need to do recertification and offers several recommendations. The Department of Human Services has offered to look at making a policy concession to not require families to have somebody receiving other DC benefits such as TANF or Medicaid who presumably had face-to-face interaction with the Department of Human Services to recertify, and we support that. There has also been a backlog in eligibility processing in the past at IMA, and DCPCA has led that there will be an influx of 15 new FTEs via the Mayor's FY 2012 budget. DCPCA urges the Department of Human Services to not begin conducting recertification until these staff are sufficiently trained and to consider placing some of these workers directly in our community health centers or creating a process to permit existing staff at community health centers to process eligibility internally. DCPCA is deeply concerned with persistent and generational poverty in the district, where nearly 1 in 5 residents lives in poverty, about 1 in 3 children live in poverty, and roughly 1 in 5 workers has a job that won't lift the family out of poverty. DC receives $92 million in federal TANF block grant funds and in return must spend about $75 million in local funds. Programs like TANF give parents who are unemployed or underemployed extra income to meet their family's basic needs. And the FY 2012 proposed budget reduces the cash assistance portion of the TANF budget by $11 million, primarily due to several major changes such as full family sanctions, the 5-year time limit on TANF benefits would be phased substantially from October 2011 through October 2013, and the addition of staff to help TANF recipients with disabilities apply for federal SSI benefits. Before anyone is cut off TANF or even has their benefits reduced any further, there should be substantial case review to see what training and support has been offered to that family and what reasons exist for preventing the individuals in that family from finding suitable employment. If it is determined that adequate assessment, training, support has not been offered, remedial action should be taken place before any further benefit reductions are put in place. An analysis should also be done of the contractors for the welfare to work program. Which ones have shown success and who has done a good job of helping DC families access jobs that have a fighting chance at rising above poverty? And new contracts will include additional pay-for-performance incentives for finding long-term employment, the power to SSI initiative, etc. An RFP process for new contracts was supposed to be implemented, yet has continued to be delayed. And finally, the Interim Disability Assistance Program. Mayor Graham's FY 2012 budget proposal will eliminate all funding for interim disability assistance, effectively ending the program in September of 2011. IDA serves as a vital lifeline for 1,500 of the district's most vulnerable residents with disabilities, individuals who cannot work and have no other income, while they await a decision on their federal supplemental security income application. The program is crucial for the district because it reduces reliance on costly services such as emergency shelter or unreimbursed medical care. It helps residents with disabilities move quickly out of homeless shelters through access to housing programs with minimum income requirements, and maximizes enrollment in federally funded medical assistance for district residents with high medical costs, reducing long-term reliance on locally funded aid. The bottom line is that these programs help people to maintain a little dignity, meet their basic needs, and stay connected to support networks that help people find jobs, access education, and see their doctor or social worker and get prescriptions. For some, the health insurance or extra income from TANF or IDA even helps prevent them from becoming homeless or move out of homelessness. We hope the government of the District of Columbia continues our partnership by providing the resources and support that we need to achieve health equity for all district residents. Thank you for the opportunity to testify on this important issue, and I'm happy to answer any questions you may have.
Thank you very much, Mr. Liebers. Now we go to Ms.